All right, we are working. Technology is with us today. I'm always so grateful. And welcome to the High River and District Healthcare Foundation. This is our next healthcare conversation. My name is Jody Seeley, and today I am joined by cardiologist Dr. Greg Schnell and also community advocate, one of our foundation board members, and one of our amazing local business owners. Verna Leman is here to share her story. And throughout the month of February, our focus on women's health with the foundation was heart health and cardiac issues and heart disease and just taking care of that big, beautiful heart in our bodies. And so this is what our conversation will be with today. And I'm going to start with you, Verna, if that's okay, and just have you share a little bit about your personal experience, because recently you had a cardiac event, I think they call it. I don't know if that's even the proper terminology, but would love for you to share with us what happened with you.
Oh, hi. Good morning, Jody. Good morning, everyone. Yes, it was in November 29th of 2020, and I had actually had a cardiac arrest. The important factor is that I don't have a lot of memory of the event, which quite honestly I'm okay with. And I don't, and even the day before, where I was very, very blessed because my husband, my partner, is a paramedic and was able to be there. Number one, most importantly, quite honestly, and I done a lot of talking this morning that I'm not going to get emotional about this because I thought I was all good. So, um, quite honestly, I would not be here. I would not be here if it had not been for the CPR that Sam and in being able to talk about it, I guess is what I'm saying, because Sam was able to provide that CPR that now I understand was crucial, right, Dr. Schnell, crucial for what was going on, because I actually had, I guess, passed away is the word, for 6 minutes, and he was able to provide that CPR that I needed until the medical help could get there and do the defib, which they had to do twice, and then from there we were off to the hospital. I think the key thing for me is that, sadly, for memory, I can't say that I had any definite signs. I know that I was having a little bit of a health issue for a good month and a half before, with a rash, which they called a urticaria rash, that we were trying to treat. So again, was that part of it? I don't know. I really don't know that. Dr. Snell, that would be a great question for you down the road. But I was on definitely some medication, antihistamines and prednisone, to try and control that. Other than that, I really didn't have. I've had a fairly normal, healthy life. And so to have this event was not only quite a shock, but I it's just amazing that I'm standing here, number one. And if it wasn't for Sam, for the team, I wouldn't be. So I'm very thankful.
Well, we are very thankful that you're with us today to share that on so many levels. You're an amazing woman and you do so much for our community. So we appreciate that. And then just having the courage to share your experience, because one, it is very emotional and it's not easy to do. And I think that I can imagine knowing you, I could imagine you like waking up in the hospital and being like, I had a what? Like, are you kidding me? And I think that's probably fairly common, Dr. Schnell, that women would be surprised that they were having a cardiac event because I don't feel like we hear enough about it.
Well, you're absolutely right, Jody, and thanks, Verna, for telling your story. Yours obviously is very dramatic, and I'm glad that you had such an outstanding outcome. When we talked, we're not going to focus on out-of-hospital cardiac arrest today, but when we talked, I told you, the most important thing about your story is the fact that you had somebody nearby that could provide CPR. And regardless of all the fancy things that we subsequently do, what's critical in surviving out of hospital cardiac arrest is what happens in the first 5 or 10 minutes in your home or in the hockey rink or in the shopping mall. And to have someone provide even minimal quality CPR makes a world of difference. And so maybe the first thing we should stress to our viewers is to say, please, if you've not been trained in CPR, please get trained. It doesn't matter how old you are, how frail you are, how smart you are. It's a pretty basic skill that anybody can learn, and it saves lives. And you're a living example of that. Yeah, Jody, we talked a little bit, and I think what we want to emphasize, and what the cardiology community is trying to emphasize to everybody, particularly during Heart Month and this increased attention on women and heart disease, is that heart disease in women is underappreciated. Right? We think of it as a man's disease, and that's unfortunately not true. Once you're past the age of 50, the leading cause of death in women is heart disease. It's not breast cancer, it's not ovarian cancer. And in fact, the incidence of heart disease in women over the age of 50 exceeds that of men. And so it's really important that everybody in the audience, both medical and non-medical, appreciate the fact that women can have heart attacks. It often, even in men, happens without warning, like Verna's story, so it can be catastrophic. And prevention is really the most important thing, and that's why it's important to realize that women can have heart disease. And the things that we talk about in terms of preventing heart disease, like not smoking, getting regular exercise, getting your blood pressure and blood sugar and cholesterols checked, are all just as important for women as for men. Jody, we can go down one of two ways here. I can let you ask me some questions, or we can talk about other
I'm
aspects.
sure you can probably just say all kinds of things.
Yeah, I can blab on for hours.
I wasn't going to say the word blab, but I kind of wanted to say the word blab, but in a good way. Like, that's why you're here to talk about it. Before we have you jump into that, I guess I just wanted to circle back to Verna and just say, like, what do you feel is the biggest thing you learned from your experience?
Jody, I think the biggest thing that I learned is not to be afraid to go get help. We tend to be a little bit of, for a lack of a better word, martyrs, where, I'm feeling a bit tired, which that is the absolute only symptom that I recall. And Sam had said that, just going back a bit more history, was that we had been out. I got up in the morning, we had been out, gone over to Canadian Tire to buy some casserole dishes so I could make chicken pot pie for my sons. And, of course, I was not feeling 100% because I was dealing with this rash, but I was doing fine. And he said, you come in, you turned the oven on, and then you said, I'm going to sit down. I feel a little bit tired. Which, if I guess there would be a connection, maybe that was the connection. And he said, you sat down, literally, he said, I turned to say something to you and recognized that we were in some trouble here. So that would be the only symptom that I guess would be defining at that moment for me. But I also know that after and following this, going back, there would be times that we were trying to get blood pressure regulated and medicine sorted out, all of those things to keep me healthy when I got home. And there was a certain, 3 times that we know of me having to go back to ER just to, because of blood pressure being up, or just more of, I think, anxiety that I look back now. And I was like, Sam would be, no, let's go. We're going, your blood pressure's up a little bit. And I'm like, oh, no, I don't know. It'll be fine, So that is one thing that I would definitely stress to women, not waiting till after, but even before. If you're seeing that things are not normal, or even if you're feeling a little bit tired and blood pressure is up, then maybe we do need to take a little more serious, rather than going, oh, I'll just drink a bunch of water and carry on, right?
I'll be fine, because that's what we do. Yeah. All right. Thank you, Verna, so much for sharing. So, Dr. Schnell, let's start with some of what do those symptoms look like? I don't know if I think we know a little bit about what a heart attack symptom looks like, that we saw on commercials or things we've been told about arm pain and different things. But when it comes to this in women, what are some of those symptoms? What are we looking for?
Right. Well, it's about 50-50, Jody. Women can still have classic symptoms of a heart attack. And we all kind of think about this, and this is a pretty good, there's actually a medical name for this, because it is a pretty good sign for someone having a heart attack, and that is you feel this squeezing pressure-like sensation in the center of your chest. In people, classically, it can radiate up into the jaw and neck. And it's funny how sometimes it seems to affect the lower jaw, like your teeth ache almost, and then classically down the left arm. What we know in women is that about 50% of people can have what we call atypical or non-typical symptoms, where instead of it being sort of a crushing central chest pain, it can feel sharper, maybe a bit more on the right side than the left side, maybe a little bit more down the right arm compared to the left. And then sometimes women tend to have more a sensation of shortness of breath rather than pressure or squeezing. And I see Verna nodding her head. Sometimes they can more commonly have, nausea and feel sweaty and a sense of something's just not right. This feeling of kind of impending doom. As Verna pointed out, particularly in people that have previously been healthy and are successful business people and are mothers and are busy, there's a tendency to put things off, right? I've got things to do. This can't be my heart. I don't want to go. And so we do know that women, when they do present with heart attacks, tend to present later than men because they tend to dismiss their symptoms. Partially because they might be atypical, but also because, again, this belief, I can't be having a heart attack. But also I've got to get the casserole made. I can't go to the hospital today. So, it is important that we pay attention to our symptoms. That being said, unfortunately, sometimes there are no warning symptoms and people can just have it come out of the blue and collapse like Verna did. Now, fortunately, that's not all that common, although I can tell you that we have one patient a week in Southern Alberta that we look after at the Foothills Hospital that has out-of-hospital cardiac arrest. So that's the subtle differences in symptoms. Sometimes still classical, but we certainly know that women have a higher incidence of these less than typical symptoms.
Do you think or feel, or do you see in your line of work that is there any stigma that surrounds this? Because I feel like a lot of people think, well, cardiac events or health issues only happen to people who are unhealthy, and whatever somebody's vision of what unhealthy means. Because I think if we look at Verna, and anybody in the community who knows her would consider she's a active, healthy woman. You wouldn't expect that. And so I wonder if we battle a little with stigma surrounding cardiac events.
For sure, Jody. And, we know that the classic risk factors for heart disease make a difference. So smoking, high blood pressure, diabetes, obesity, lack of exercise, high cholesterol. If you look at odds, those patients are going to have more frequent heart events. But that being said, unfortunately, there are lots of patients who do all the right things, have none of the classic risk factors, look after themselves totally, and still have heart attacks. And the flip side is you have patients that do all the wrong things and never have a heart attack.
Yeah.
So there's a genetic component to this that we still do not entirely understand. It's not like classic genetic conditions where 50% of people are going to get the problem. But we certainly know there's an interplay there that we still haven't entirely figured out. And at the end of the day, age is the biggest risk factor. That I would say you can blame the big guy or whoever you believe in that there's a fault in the design system a little bit, that a third of us are going to get this problem if we live long enough. Sorry, Verna, go ahead.
No, one of the things that I feel is important to express too, is that there definitely is a very huge genetic heart issues in my family. My mother had an aneurysm of the aorta. I was telling Dr. Schnell, became paraplegic. I've lost family members to massive heart attacks. So recognizing that, having said that, I've been very, very fortunate too, because my doctor is aware of that. And my goodness, she has just jumped all over me to, really pay attention to this. And we did, and we thought we were. So yeah, I just can't imagine the things that, the doctors, the cardiologists have to deal with to try and get or figure. It's mind-boggling to me, because there isn't just a black and white picture here. It's a big, big picture.
We know that a positive family history and a first-degree relative doubles your baseline risk of heart disease. And there's also some pretty unique female risk factors that are becoming more apparent now. So, for example, if you developed hypertension while you were pregnant with children, what we call preeclampsia. We know that that increases your risk of subsequently developing heart disease. And also, if you developed diabetes with pregnancy or gestational diabetes, that increases your risk of developing heart disease later in life. So these are unique risk factors that are now becoming apparent that we never really kind of appreciated before, that are special and unique to women.
Yeah. So you said at the beginning, Dr. Schnell, like heart disease in women is underappreciated, it's underdiagnosed, and it's undertreated. So how do we move forward to try to shift that reality a little bit? What can we do?
Well, what we're doing today is very helpful, Jody, right? That we have to make more women in the community aware that heart disease is common, and that they can have heart attacks, and to take their heart health seriously. Unfortunately, a lot of times with heart attacks, there is no warning. And so that's why preventative health is so critical. And it sounds boring and a bit, and I apologize for using motherhood, but maybe that's a good word to use in a female heart health discussion. But these comments, you've heard since we were born, so to speak, about getting exercise, losing weight, watching what you eat, being active, stopping smoking. All these things really make a difference, and they're boring, but they do make the most difference. And so having women see their family doctors and following up on their heart health risk factors is important. Again, there's historically been a perception that I'm not going to get a heart attack, I don't have to worry about it. So that's the most important thing. I think, in the medical community, certainly there's been an enhanced emphasis over the last few years on women and heart disease. We know historically that clinical trials, for example, were always male weighted, and we know that female hearts are not the same as male hearts, and so we're starting to do more and more research aimed specifically at women with heart disease, so that we have a better understanding of how to treat it and diagnose it and manage it.
Well, is that something that as women we can advocate for in the medical field? Like I pardon my ignorance in how some of that works, but is there a way to use our voices and our collective impact to ask for more research to be done, or does that just occur through the medical field? Like, is there a way that we can sort of help with that?
Good question, Jody. I belong to the Libin Cardiovascular Institute at the Foothills Hospital in Calgary, and they have an initiative called CD and Me, which is specifically aimed at enhancing research into women's cardiovascular issues. And I know that our communications committee on the Living Cardiovascular Institute is more than happy to reach out to local groups like High River to facilitate their involvement in that process, which includes research, but also educational programs, etc., about women with heart disease. I think at the grassroots level, what's important for all of our listeners is to advocate for themselves with their family doctors. I hate to say it, I don't hate to say that my wife's a family physician, but I hate to say it that family physicians do a much better job at primary care than we do. And your family physician is a portal to make sure that you're being well looked after, and they do an excellent job of that. Far better than I think we as specialists do, because we don't see people as often, right? We don't have the same relationship. So in answer to your question, those are kind of two things that I could think of. Advocate locally with your family physician to make sure that your health is well looked after, and then reach out to whatever organization. Heart and Stroke is a great access point for women with cardiovascular disease health issues.
I love that. Well, and I think too, I like when you bring up advocating yourself, because I think we often have a mindset of, well, it's probably not that important, or I don't want to take more of the doctor's time, or I'm feeling okay. Like we come up with a number of reasons or excuses or thoughts that prevent us from being maybe a little bit more vocal about when we just feel off, and trusting that inner wisdom of yourself and your gut, that if you're feeling a little bit like something's not totally great, express that. That doesn't make you the patient who's annoying. And even if it does, who cares? Like, you have to advocate for you.
Dr. Schnell, if I can jump in, Jody, we talked back again to when we were having a conversation about signs and symptoms, and we talked a little bit about women going into menopause. Can you touch on that?
Sure, and let me acknowledge that I'm not an expert in menopausal health, but what we do know is that, and I alluded to this when we started, that estrogen is protective, and that's why women under the age of 50 tend not to have typical heart disease, and we should just expand on that when I finish. Past the age of 50, that loss of estrogen we know enhances what we call atherosclerotic process, which is the deposition of cholesterol into the lining of the heart arteries that leads to traditional types of heart attacks. So, like I said, women are somewhat protected from typical heart disease before the age of 50 or whenever they go through menopause, but after that, their risk increases and, in fact, surpasses that of men. It is important to know that women under the age of 50 can have heart attacks from other causes. So, typical heart attacks are caused by cholesterol buildup in the lining of the artery that causes the inner lining of the artery to crack or break open, and the body thinks it's cut itself and tries to heal it by putting a blood clot on it. So we call that process plaque rupture, and often that unfortunately occurs without warning. Women, and sometimes men, but more commonly in women, can present with atypical causes for heart attacks. They can develop a tear in the lining of the heart artery and bleed into the wall of the blood vessel, and that bruise can occlude the artery. We call that spontaneous coronary artery dissection, or SCAD. It's a very common cause of heart attacks in younger women, has an increased incidence postpartum. So that's a unique cause of heart attack in young women that we previously never recognized. And obviously, when a 35-year-old female shows up with chest pain, the belief was, well, it can't be a heart attack. But that's a very common cause in young women. Tends to go away post-menopausal. So that's one good one that gets better as you get older. There's a higher incidence in females of what we call takotsubo, or stress cardiomyopathy, which sometimes people call broken heart syndrome. And that's where, due to an emotional and physiological stress, the heart artery kind of goes into spasm and the heart quits working. And we know that there's a higher incidence of that in females. And then there's some other ones that are, rarer but more common in females: coronary artery spasm, microvascular disease, peripartum cardiomyopathy, which is a condition where the heart muscle quits working after pregnancy. So again, these are all heart diseases that can occur in young women that, again, because of sort of pre-existing bias, we can't believe that young women can have heart problems. We have to make sure that people have an increase in awareness. You have my cough, Julie.
I was going to say, we were so worried about you coughing during this. Now it's my turn. Since I'm going to still continue to cough, anything else you want to add before we go?
Well, maybe one last comment. We've talked about underdiagnosis. We've talked about underappreciated. We know as well that even in women that have had heart attacks, they're often undertreated, and it's not because of lack of want, but we know that women tend not to go to cardiac rehab programs after heart attacks because, again, they feel that they're busy people. They may feel like this is a man's disease, and they don't want to go hang out with a bunch of old guys running around a track. So, we know that for typical coronary artery disease, good medical therapy and a good cardiac rehab program all help reduce your risk of another heart attack. So for our viewers in the audience, and I see Verna nodding her head, for our viewers in the audience who've had heart troubles, making sure that you carry on with your treatment is really important. We don't cure heart disease oftentimes, but we can control it, and we can certainly have a major impact on reducing people's risk for another event with good medical therapy afterwards.
And Jody, can I just jump in again for a second? I 1,000% agree, Dr. Schnell. If I had not had that, I mean, obviously my comfort is Sam, but being able to go to the heart clinic after and knowing that they were there, a phone call, plus I could go and they were, we were doing the stress test, that was hugely comforting to me. So I would hope that, ladies, men too, continue to follow up after that, to continue to go through the whole program. Because I think, and I understand that sometimes once we start feeling better again in ourselves, we're like, no, I don't need to go to that today. Yeah, you do. Yeah, you do.
When I think too, if history proves itself well, if we have a cause and something we need to advocate for, women are incredibly powerful at that process. And
Yeah.
so I think the three of us could easily challenge all the women in our communities to start having conversations about cardiac care and checking in with friends about it. And if you're and Dr. Schnell, you say like some of the preventative things seem boring, but like find ways with your girlfriends or your tribes that you can do this in a fun way. And maybe you have heart parties or like your menopause talk party or whatever it is going to be. Find a fun way to keep the conversations going and advocate for it within your circle of friends, because I think that's where we can lean on other people that we feel safe with. Would that be in your
That's,
brains too?
that's great advice, Jody. Go for a walk. I mean, please, everybody, go for a walk. That it's boring sometimes, but go for a walk every day. It's fantastic exercise for your heart. I love people that have dogs because I know they're going to go for a walk, but everybody can't have a dog. But get together with your friends and go for a walk. If there's one thing that we could all do to help improve our heart health, it's to go for a walk.
And it's very interesting, again, Jody, just in the work that I do in my business, obviously coming back from the event, the conversations that I was having with ladies, which is my clientele, the amount of cardiac and heart issues and that I have heard about since then is unbelievable to me. And again, those conversations weren't happening. It was almost like we were able to make that connection. Once we made that connection, it's unbelievable to me how many ladies are talking about heart issues that they've had.
Yeah.
So
we
we need to start the conversations. Yeah.
Absolutely. Oh, and it doesn't probably feel really fun when you get together with a group of friends to be like, so how's your heart health?
Yeah. Yeah.
Nobody's like passing around the Baileys talking about that, but
Yeah.
I mean, you could and start having some of those fun conversations, I guess. Make them fun. That's what we can do. Dr. Schnell, Verna, I want to be mindful of everybody's time today and just thank you so much for taking some moments to, one, Verna, to share your personal story. We are so blessed that you're here to do that. And Dr. Schnell, thank you for the incredible work that you do and the opportunity to help educate us a little bit more on how we can advocate for better heart health in our communities.
Thank you, Dr. Schnell and Jody. Jody, you and we need to chat about doing something about this promotion of some kind.
You bet. So
Thanks,
get the wheels
Jody.
turning, right, Dr. Schnell? Yeah,
Absolutely.
we're going to take over the world.
Yeah. Well, let's have a little
right.
fun. Maybe developing a cardiac rehab program in High River. That would be a great thing, right? Rather than folks having to travel downtown. I see Verna smiling already.
Boom.
Planting a seed, right like that. This is why we gather minds together. So thank you very much for your time. Dr. Schnell, we're probably going to be circling the wagons back with you on that idea. Thank you, everybody, for taking an opportunity to have this conversation with us. We invite you to share this video onto your social media. You can take a look back through the foundation's socials throughout the month of February. We shared a lot of great information about heart health, and we want to continue those conversations also. So share, and thank you so much for taking time to learn more about your health. Have a great day, everybody.